Welcome to the Senior Network. I'm Christyn Gialanella, joined with my colleague, Dr. Kamal Patel. Thanks so much for being here today.
Thank you, Christyn.
Always a pleasure to see you. Today, I thought we would talk a little bit about yearly health screenings. As a primary concierge physician, it's one of those things that's always on a lot of our to-do lists, but often doesn't get done.
Sure.
So I thought we could chat a little bit about what your yearly annual preventative recommendations are for your patients.
Sure. Obviously, some of it's going to depend on the individual
Sure.
and their personal chronic conditions, their lifestyle, and things like that. But I'd say generally when we see an individual, we want to kind of see what their lifestyle factors are. How's their diet? How's their exercise? How are they sleeping? How's their mood in terms of anxiety, depression, or stressors from their work life, family life, things going on in their life. And we also want to make sure, get some basic diagnostic testing, things like mammograms for females. Generally, for the average individual would start at age 40 and then go annually as appropriate. Prostate screening antigens or PSAs for men. And then blood work to look at cholesterol levels, sugar levels, how are the kidneys and liver doing, how's the blood levels doing in terms of anemia or infection. Sometimes thyroid levels, especially for women that could be more prone to thyroid disorders. Vitamin D is, I'd say, one of those low-hanging fruits that a lot of people are deficient or suboptimal.
Absolutely.
And I would encourage everybody to probably have at least a baseline vitamin D level as well.
Sure.
That's usually something that often many of us need supplementation just to get better levels or more optimal levels.
Absolutely.
And then, sometimes for those cardiac patients with heart issues, EKGs, if they're not up to date, is sometimes beneficial as well. But generally say, mammograms and then blood work for men and women, just to get a general basis and then get going into the details of their personal lifestyle and kind of seeing where things stand. I think that gives me a good overview from a preventative standpoint of what to recommend, how to interpret their labs and things like that.
Okay, wonderful. One thing that comes to mind, just because it's caught a lot of attention recently, is kind of borderline insulin resistance or pre-diabetes. Is that something that you check in everyone, or is it only starting at a certain age?
I generally would say, medicine always surprises me. There's no textbook individual. We all go through our training and textbooks and stuff, but when it comes to real world issues in individuals, there's always exceptions to everything.
Okay.
And I know a lot of times it's the numbers game of, well, if it impacts 1 in 1,000, is it worth it? But I'd say for that one individual, it is absolutely worth it if we find something that maybe it was a little bit outside of the general recommendation. So I generally say, at least for adults, having a baseline blood work and an exam on an annual basis is probably a good idea.
Sure.
We do far more checkups on our cars on an annual basis. I think we deserve a little bit of some of that same stuff.
Absolutely. We as humans need attention as well.
Exactly.
So, okay, wonderful. Obviously, you and I understand why screening and preventative care is so important, but oftentimes it's one of those things that kind of falls to the bottom of people's to-do list. Can you kind of speak to just why it's so important, even if you're feeling well, to seek preventative medicine?
Sure. I go back to the analogy of the car. I mean, I think why do we take our cars to the mechanics? It's to prevent the breakdown that puts us on the side of the road or an expensive fix at that point. So, I think our bodies are very similar in a mechanistic way. If we work on prevention and proactiveness, that hopefully that's going to avert chronic diseases. When we have chronic diseases, we don't feel good. We're not at peak performance levels. We're not as happy. We're not enjoying things. We're more kind of focused on problems and dealing with those.
Yes. That
often cause limitations, and that's a trickle-down domino effect that can affect our psyche and our sleep and our pain levels and all that stuff. So, it's one thing to treat chronic diseases, and many of us have those, but it's also important to know the power of prevention and how that can really kind of keep us living longer and healthier and hopefully kind of add better quality to our lives.
Absolutely. One final question, just as we're entering into the holiday season, and this is kind of at the forefront of everyone's mind. cold and flu season, any tips from a primary care doctor?
Yeah, get your sleep, eat healthy, try to exercise, and you know, if your diet is well-rounded, you're probably getting a lot of the nutrients and antioxidants that you need to kind of hopefully fight off that cold and flu as best as possible.
Wonderful. Well, thanks so much for being here. Always a pleasure.
Thank you, Kristen. Take care.
Thanks.